call for Professor Hazem. Professor Hazem Ashmawy is at the university. He was going to speak about step counting technology can be a useful tool in managing of diabetes.
Thank you, Mr. Chairman. اولا انا بشكر الاستاذ الدكتور ايناس شلتوت على اتاحت لي فرصه ان انا القي المحاضره النهارده والتقي بحضراتكم. Today we'll talk about the step counting technology. When we talk about technology in diabetes, technology now it become a part from diabetes management. Even the CGM devices, insulin pump, even the new insulin analogs is made by technology. So technology become important part. We can't ignore technology in management of your patient. One of the main factors underlying type 2 diabetes is the imbalance between energy and expenditure and intake. So physical activity increases in energy and expenditure and improving glycemic control and therefore reducing the risk of diabetes-related complications. So when you look for this balance between management of blood glucose, energy intake supported by meal and energy expenditure by exercise. So if we look for what mechanism can improve blood glucose control, if you look for the mechanisms that can improve blood glucose, if you look for meals that lead to increased blood glucose and the insulin level, at the same time exercise and muscle contraction increase the adenosine monophosphate dependent protein kinase. Both increase glucose uptake into the cells through GLUT4. So blood glucose become under control. So continuous exercise increase GLUT4 sensitivity to insulin and gene transcription for GLUT4. Therefore, daily continuous exercise may improve the insulin resistance. So physical activity also exerts indirect health benefit, as you know, through influencing weight loss and blood pressure. However, most people of type 2 diabetes are not physically active, or at least less active than people without diabetes. So movement and exercise play a vital role in health maintenance and preventing complications with diabetes. Regarding type 2 diabetic patient, type 2 diabetes can be reversed and or managed with lifestyle modification rather than drug regimen in early stage. Even in any recommendation for diabetes management, the first thing is lifestyle modification. So lifestyle modification by diabetes education and exercise, even before any medicine, in any recommendation. So the monitoring of community of during 70 years old demonstrates that higher step count associated with low risk of diabetes. So physical activity on a regular basis can improve metabolic control and blood lipid profile, blood pressure, quality of life. Most patients with type 1, type 2 diabetes should engage in 150 minutes or more to moderate and vigorous intensity aerobic activity per week. That's spread over at least 3 days a week with no more than 2 consecutive days without activity. We are talking about the time, 150 minutes. But how can we measure the amount of activity inside this 150 minutes? Some people with slow walking, or vigorous walking, moderate activity. So we need to measure this amount of activity besides the time spent during this activity. ADA, according to ADA, physical activity exercise should be recommended to all individuals with diabetes as a part of measurement. Important part of measurement of diabetes is physical activity. So overall health, tailoring it to meet each individual for individual specific needs. Nowadays, the increased commercial success of physical activity monitoring device, pedometers, accelerometers, indicate public acceptability and cynicism of self-monitoring within general population. So what is pedometers? It is just step counting device. It can to know how many steps you make during this physical activity or during walking. Accelerometers, which is similar to inside our smartphones, it's more complex and give us the intensity of physical activity, not just the count of steps calculated. So available evidence suggests that routine use of activity monitors can motivate significant increase in physical activity. So the first benefit of activity monitor is the motivation. When you have a certain, you're challenging a target in activity monitoring and you achieve this target, it will motivate you to further higher goal. So the first benefit of activity monitor is motivation for significant increases in physical activity within general population and within obesity research, and have a beneficial effect on body weight. Several reviews also reported the positive impact of activity monitors on people with type 2 diabetes. So the additional information on accelerometers, زي exercise intensity as we said before, and exercise expended calories, كل ده can affect some behavior change technique, يعني goal setting أو feedback للperformance اللي البيشنت بيعمله. وبالتالي هنا performance increasing motivation and increased physical activity. So simply what is pedometers, as we said before, is the device that measures the number of steps. Don't provide any other information other than number of steps. But accelerometers is a device that inside computers, smartphones, through app, through Apple Store or Play Store, you can download app that use the accelerometers inside the smartphones and give you data like steps, intensity of activity, and all this depend on algorithm convert data to usable format like energy expenditure and metabolic equivalence. So several guidelines and consensus statements do recommend increasing daily step count, improve cardiometabolic health. For example, ADA, ASD 2022 consensus report the management of hyperglycemia type 2 remind us that increase of just 500 steps per day is associated to 2 to 9% reduction of risk of cardiovascular morbidity and all-case mortality. Moreover, 5 to 6 minute brisk intensity walking per day equate to around 4 years greater life expectancy, which gives us the importance of physical activity in management of diabetes. So step counters, pedometers, have widely studied as behavior changing tool. As we said before, motivation tool or behavior changing tool. Wearing the device may prompt activity and provide feedback with self-monitoring. As any device for self-monitoring, when you have weight reduction, the scale is give you self-monitoring for your achievement. Even CGM, like glucose monitor, give you idea about your achievement and your self-monitoring. So it's the same for physical activity. We are in need to measuring device for amount of activity. Is it enough? Is it too much? It's okay. So thus adults with type 2 diabetes should initially set feasible or achievable goal for step per day before progressing toward higher goal. And this is through the motivation, as we said. Using daily step count, step goals like 10,000 was predictive for what? For increasing participation. Before any other benefits, for increasing participation and motivation. So when we said about exercise activity, your goal, fixed amount of steps? No. Fixed amount of activity? No. Your goal is to increase your movement from your baseline. There's many studies that measure the step count along the years from 2013 to 2019, measuring the effect of step counting and step counting device. This one of the study in adults with type 2 diabetes, self-reported regular walking lead to greater than 40% reduction in both mortality and vascular event rates. As a study by Disputa et al., randomized controlled study of 275 participants with either type 2 diabetes or hypertension. The aim to achieve an increase over baseline, whatever the baseline, over the baseline of 3,000 steps per day over 1 year for interventional group. For control group, usual care engaged to 30 to 60 minutes of activity daily. So what's the result? Is an improvement of both A1C, 0.38% reduction, and insulin resistance, 0.96 reduction in home IR, with only 20% step increase per day. Even with this small increasement in step per day, you will still get the benefit. This is another study by Fahon et al., randomized trial for 46 adults with type 2 diabetes. Examined effect of target. What's the target? 10,000 steps per day prescription on glycemic control for patients with type 2 diabetes for 10 weeks. Interventional group, as we said, given goal to accumulate 10,000 steps per day. But control group maintained normal activity habits. The end line, A1C, was lower by 0.74%, and the average daily step count from intervention group to control group, about 6,000 steps per day, and 4,900 steps per day, respectively. And 6.1, just only 6.1 achieves the goal. So even not achieving the goal, or small number achieving the goal, still there is a benefit from increasing your activity. As you said, the main purpose of activity monitors is to increase your physical activity over the baseline. So despite small increase in step count and non-attainment of the 10,000 step per day goal, there is still significant reduction in inline A1C, improved glycemic control of the participants. So increased physical activity that are below recommended moderate level are still beneficial to the health. Also, individuals should be encouraged to increase the physical activity and daily step count to the level that are comfortable before setting or gradually progress to higher level. Even aerobic exercise may increase in insulin sensitivity without measurable increase in maximum autotension. It has both acute and long-term effect on insulin resistance. That's why walk-based pedometry is an effective method to preventing type 2 diabetes and metabolic syndrome. So what's the application of pedometer in the management of IGT, or blood glucose tolerance, in pregnant women? Before we talk about this, let's look for the insulin resistance does cause IGT during pregnancy. However, in type 2 diabetes, exercise, and in IGT during pregnancy, also exercise increase muscle contraction and glucose uptake. But in type 2 diabetes, non-pregnant, there is suppression of gluconeogenesis in the liver due to hyperinsulinemia. And this leads to decrease in blood glucose level. But the question is, blood glucose level decrease the same as type 2 diabetes in pregnant women with IGT? The answer is no. Why? Because even with exercise, blood glucose are maintained during pregnancy because of both exercise glucagon level. There is increase in glucagon level just after exercise, which maintain blood glucose. So during pregnancy, both exercise glucagon level are sought to increase and maintain blood glucose level. So this study was talking about the application of a pedometer in management of IGT in pregnant women. It's a small study, just 7 pregnant women with IGT who were provided with 3 pedometers, 3 gestational diabetes, 1 overt diabetes in pregnancy, 3 pre-gestational diabetes type 2. As you see, this is sheet data for the date, the amount of steps per day, and the time. And the measurement of the number of steps per day was before breakfast, after breakfast, before and after lunch, and before and after dinner. And the summation of the number of steps in the morning, afternoon, in the night, is the total number of steps per day. So as we see the result, no correlation between the number of steps per day and blood glucose in the morning, afternoon, or night. Because as we said, the glucagon will maintain blood glucose just post-exercise. However, negative correlation is significant between number of steps and change in A1C, comparison with 4 weeks based data, with change in maternal body weight, with total amount of insulin administered. So the result indicates that pedometer monitoring walking improve insulin resistance without affecting blood glucose. Okay, blood glucose will not be affected just after exercise. But you have other effects later with like A1C reduction, over gestational weight gain, insulin injection, and non-hypoglycemia, in addition to self-monitoring effect, of course. So what kind of exercise is suitable for here? Either slow twitch muscle fibers or fast twitch muscle fiber. Of course, slow twitch muscle fiber, and measured by pedometry, will increase fat storage ability, insulin binding ability, insulin-dependent glucose uptake ability, and increase glucose transporter, which lead to improved glucose metabolism. So this study was comparing the smartphone application versus traditional pedometer, because I said that new smartphones equipped with inside with accelerometer and just application apps are downloaded, you can have smartphone monitoring your activity. So it's more easy طبعا and even more superior at low walking speed. Smartphone pedometer must be superior also for the pregnant woman. So with the widespread use of smartphone equipped with pedometer function, exercise by walking is easily monitored and utilized in both healthy pregnant women and pregnant women with obesity and IGT. So finally, if we look for the management blood glucose, insulin injection support energy intake by meal, and here pedometer support energy expenditure by monitoring the exercise activity. Thank you.